Transparency requires the courage to look yourself in the mirror and realize that you're not all good. AI creates an unbelievable opportunity to think differently about interoperability.
Well, and healthcare is a business. Whether you like it or not, healthcare is a business.
Tune in for today's episode of the Leadership Lab, Clarity Special Edition.
Thank you for joining another episode of the Leadership Lab with Asbel Montes. This is our special edition series that we are doing following our user summit, our 5th annual user summit in the beautiful Laguna Beach, California. It's been all about data, doctors, and leadership through the eyes of the patient. And this time, as no surprise, he has been a guest several times on our podcast, and he was part of my inaugural one, Dr. Eric Beck. We've known each other for a while. He doesn't need an introduction, but Dr. Beck, thank you so much for joining me on this special edition.
Yeah, thanks for having me back. Look forward to it.
I'm really excited. I love our conversations. It's spurred a lot of dialogue. Our first one we talked about, really talked about some stuff that you've been working on for years. And you and I have a history when it comes to this innovation, this transformation that's beginning to happen. And with you leading one of the largest EMR companies in the world, we're really focused on stuff that's happening here domestically in the United States, and a lot of transformations happening. We're coming off of a summit where we had Kim Brandt here talking to us as the COO and Deputy Administrator for CMS about fraud, waste, and abuse, some of the data, how they're using AI. But I want to talk first with you really around the EMS data and healthcare economics. You have been kind enough to introduce me as I'm on this doctor kick, that I'm done with the same playbooks. The doctors need to lead this. And so if they're not leading it, why aren't you leading it? Dr. Moy, who is here as well, kind of just talked about sometimes it might be the insecurity of the doctors. But Dr. Cozy gave me an aha moment on a podcast that I did recently. And thank you for introducing me to Dr. Cozy. But he said to me, he said, you know what, Asbel, we go through almost 13 years of school, from internship to fellowship to residency. And he said, we never learned about the healthcare economics of it. He said, I had to go back and get my master's degree. Some of his colleagues will have great mentors that take them on the healthcare economics. But many of them, and he gave a story about a physician that came up to him and said, you know, I just don't know. I need someone to teach me. And I believe that is probably where we've gone wrong, where I've gone wrong. And I'm first to admit it, because ego likes to get into the room. Ego likes to sit at certain tables, and really you don't need to be at that table. Somebody else needs to be there. Maybe you're guiding them to that table. So I want to talk about that because that's your personality. As long as I've known you, you've always been kind of that guide. You're slow and stealth in a room. You just sit and observe. You talk. I like to talk a lot for people that don't know that. But talk to me about data. You've been working on something about data. We talked a little bit about this, but let's talk about the intersection of that and healthcare economics now, and what you're doing as a company. And it's going to segue into some other stuff because you're doing some exciting things right now, and you're disrupting the markets. You're causing people to talk, and that's what's really important. So tell me about that intersection, and then we're going to move into some stuff that you've recently been doing and you talked about here at our conference.
Well, let's go back when I was a medical student. I had a very impactful rotation. It was quality of care rotation. They actually took fourth-year medical students and placed them with a clinical pharmacist. And at the time, I didn't know quite what to make of that, other than perhaps I'd learn a little bit about medication adherence. At the time, it was called medication compliance, learn a little bit about prior authorizations, et cetera. But really, it was a lens into understanding what they talked about as the triangle. And that was cost, quality, and access. And those sort of three pillars that drive a variety of behaviors of both patients and providers and the other stakeholders in the ecosystem. So for me, that was sort of an awareness level moment, and that's where my interest in data and healthcare economics began. But like many of my esteemed colleagues, I did not have a background in business. I did not have a finance pedigree. And so it wasn't until later that I had an interest. I went back and sought additional education My program was a master's in public health as a chassis for the program, but it was an interprofessional program with physician leaders, nursing, pharmacists, non-white coat administrators from hospitals all across Chicago. And it was a program that included experts from the business school, the law school, the nursing school, and the medical school. And so it was a really interesting intersection of conversations. So that was my first formal foray. But ever since then, I've been really interested in understanding the value of healthcare. Fundamentally, I began my career as a firefighter and a paramedic and still practice clinically as an emergency physician. And, my oath, my service, my relationship with my patients is always there at the center. But beyond that, so much of what we navigate every day in making patients feel supported, helping them, enabling them to navigate the healthcare ecosystem is really about understanding value, understanding incentives, and understanding measurement. And so those are things that we've talked about before here in this forum. But at the end of the day, value is about understanding the economic consideration for care, the impact that it drives, not only the clinical, but also what that means for a variety of other stakeholders. And the reason that conversation is so critical today is because sustainability is really a question. How are we going to sustain healthcare? And I have no doubt it will be sustained. So I don't want this to be a glass half empty conversation, but it is going to require us to change the way we think about how we all contribute to the ecosystem. And that means fundamentally a patient who today, if they're fully insured, may not have a lot of incentive to really think like a consumer might in other parts of healthcare because so much of that is being paid for by a third party, particularly if they have employer-sponsored insurance. There are others who are without insurance and oftentimes avoid seeking necessary care to stay healthy. And so to me, that comes back to the access side of the equation. So value is classically defined as quality and cost in that equation, but access is this third piece that actually is related to the behaviors we see in patients, behaviors we see in consumers, and behaviors we see in providers. Those who pay for care, the financiers of care, also have an important lens. It's a very different lens. And it's a lens that also requires us to speak healthcare economics if we're going to have a meaningful dialogue about sustainability.
Well, and healthcare is a business. Whether you like it or not, healthcare is a business. And as you're sitting there talking about the conversation that needs to happen, I'm remembering a conversation. And if you've not watched my episode with Dr. Cozy, I'm just strongly suggesting you go back. There's so many nuggets in there that he gave. And one of the nuggets that he said when we were talking was relative to, and I made a statement like, the physicians have lent their voice to others in the healthcare economics, healthcare payment reform. And he says, no, he said, we gave it away, but we're taking it back. I'm paraphrasing it, but we're taking it back. And I'm seeing a lot of that with my physician friends right now that are outside of the emergent. Like there is this healthcare where it should have been to start with. There is a patient-doctor relationship. And it's more than just the clinical care side of it, because I cannot continue to give that care unless we're going to go to the old bartering system. Somebody gives them chickens for doing that, or eggs. I mean, that used to be the old system. If they couldn't afford to pay for it, they would give something else. But there's a way to do this through a very methodical process. And that's what I'm hearing more and more of, that I'm excited to see that shift. But that is the change that you mentioned. It's not a glass half empty. We actually can do this. But this is what I'm saying right now is I'm being in rooms with builders, not critics. If you're a critic on why it cannot happen, there's not space for you in my room, because there is a way to build this, but it's going to require change, and it's going to be uncomfortable, and we might have to do things differently. To that point, I'm going to bring up a question, because you've announced this already at your ESO Wave conference. You talked about a new acquisition that you had made with a company. I think it's called, is it D2I?
D2I, Data
so I want
to
to talk
Intelligence.
About that piece, because I'm really excited about this when I found out what it was. And I'm like, I love it that you keep things very silent and then you let it go, because this is all about why we have to be transformative in the way that we think. Talk to me a little bit about what this acquisition is going to do.
Well, fundamentally, data to intelligence is one of the largest data performance improvement organizations servicing physician groups, medical groups, principally in acute care and primarily the emergency department. So many of the emergency departments around the country are staffed by groups, independent groups, regional groups, national groups, and then some are staffed by hospital-employed physicians who provide the primary coverage in the emergency department. I say staffing because it's a 24/7, 365 type of coverage model. D2I has been supporting them with clinical, operational, financial, patient experience, and revenue cycle analytics with an orientation towards performance improvement. ESO has always been about the outcomes. It's always about improving community health and safety outcomes. And with D2I, we have the ability to work upstream and connect the work that's done at 911, at dispatch, in first response, all the way through the pre-hospital phase of care, transport, oftentimes serial transport from a rural facility to an urban center, potentially a critical care team or an aeromedical transport are all part of that equation. But it ends in a hospital with a physician-led care team, and D2I helps us enrich our understanding of what happens in that phase of care. Similarly, the medical groups are hungry to connect with EMS, to bring that clinical data in to support not only care continuity, but to support all of the things that matter: quality, access, healthcare reimbursement, all of which, when thought about in a more integrated fashion across an acute care episode, is really what has me excited about it.
This episode is sponsored by Solutions Group Services, healthcare leaders' go-to source for maximizing reimbursement and inspiring innovation. At Solutions Group Services, our technology and consulting expertise help organizations recover millions in hidden revenue without disrupting their workflow. Through our flagship AI-powered tech product, Black Ink, we reveal the dollars stuck in insurance claims and give you the map to get them back. Because for healthcare leaders, they know leaving money on the table isn't an option for their organization. Learn more at solutionsgroup.com and discoverblackink.com.
And so are you planning on using this data? I know you're going to be talking about that at our conference. You're sharing data relative that you guys are beginning to mine, because you've got a bunch of data scientists and healthcare economists that work for you, doing a lot of peer-reviewed studies as well. You've got a whole a whole process that you're doing as we transform healthcare. How are you using? I know you talked a little bit about what they do, but short term, over the next 6 months, 9 months, maybe that's too long. Maybe you're going to be doing through. Talk a little bit about what the industry can expect to begin to see. Well,
we've talked before. ESO is very privileged. Our customers and our partners across the industry trust us with their data to help support benchmarking and research, and we've really leaned into that, as you've said. Increasingly, we're focused on understanding not just the clinical care, but the operational and the financial side of that equation. And what D2I allows us to do is to really take that up to the next level and to do it from a different perspective, not only from the EMS perspective, but from the physician perspective, the medical group perspective, from the hospital perspective, and from the payer perspective. And those are the lenses that EMS is really ready to lean into, developing a more sophisticated conversation around value, around healthcare economics. And so what we're focused on right now is connecting that data to the pre-hospital data that's already been part of ESO's platform for many years, all the way back to dispatch, so that we can start to ask and answer the questions that are going to help us think differently about how EMS, both pre and post-hospital, is driving incredible value, not just clinical value, but economic value that's gone unmeasured. And we've already got teams that have been working around the clock to bring that data together, to start to ask the first set of questions that we think are going to help create some light bulb moments. I'll come back to a comment you made about critics. I think it was the word you used. I like to talk about skeptics and cynics, and there's not a lot of room for cynicism. I don't find it to be a constructive posture. Skepticism, on the other hand, challenges us all to ask thoughtful questions and to really make sure that what we're talking about is real, that it's got substantiation behind it. And D2I really helps bring a connection to the physicians, a connection to richer data, both from the physician perspective and the hospital perspective, that it's going to allow us to substantiate our understanding of our own clinical practice.
And here's what I like is starting to bring in another level of transparency that you're hearing a lot about. On a podcast that I just did with Dr. Graybear, who actually spoke at our summit as well as a healthcare, talked about that her number one thing would be a more transparency when it comes to data and getting the information out there. And I know this was a part of Trump 45's initiative, and that Trump 47 with an executive order, and some of our friends, former DepSec Eric Hargan, actually is the one that this was part of one of his brainchilds around this transparency side of things with the data. And so I'm loving what I'm hearing here is that we're beginning to move that because it's going to make us think differently. Some of these age-old assumptions that we had, or we assumed because we had anecdotal data that showed us one thing, when you look at it in the aggregate and more in a transparency across a larger ecosystem, it's painting a different picture. And you're bringing that to it, and I love that piece that you're doing it as well. So kudos to you, Eric, for continuing to lead and continuing to just be a doer and not just a talker. I'm going to pivot real here because I want to end on all this fraud, waste, and abuse. And I'm really excited about a new FACA committee that the Secretary has put together about modernizing healthcare in general. In this very location in California, at our third annual user summit, I had a panel come in. The No Surprises Act had just passed. There was some stuff that was going out around there. We had done some stuff around the Ground Ambulance Patient Billing Advisory Committee. So I had some of those peers of mine come in and talk. And I remember previously a representative from CMS to CIO at the time, which was more on the insurance oversight side, that was really involved in the No Surprises Act and balanced billing, had brought in a colleague from San Diego that had written all the interoperability rules around tech. And so in Asbel's inquisitive way, I just started asking questions. Well, who was there from EMS? And he's like, I don't remember anybody that was different. I mean, we had people from Oracle and Epic and Athena. And I remember in the dinner texting you and saying, they said y'all weren't at the table. Why weren't you at the table? And this started a journey, Eric, that you are at the table and you're doing some fantastic work, because I've always have said in policy, if you're not at the table, you're on the menu. And then the only selection I can make is whatever the menu has been designed. I want to design the menu. That's what I'm talking about that's who I am. It's who I've always been, and I don't apologize for it. Let's talk a little bit about this modernization as you've gotten involved in it. We're going to end the podcast here because I don't want to make it too long, because I could sit here and talk to you forever. And we'll probably have another episode and whatever. I just try not to do too much Dr. Beck, because then people get tired of the same person spewing it. But let's talk a little bit about that. And what you expect for it to happen, what your involvement in possibly is going to be in some of these dialogues as we're continuing to all have them as we begin to work on transforming our system to become better for the patient, to where we have to lower cost. I mean, you can't deny the projections of that. We have to do something differently. So tell us what you're doing.
Well, first of all, I appreciate the encouragement. And for the record, we had been part of a number of interoperability forums and work groups over the years. But I think what you're signaling is that there is momentum building, and it isn't interoperability the way we've always thought about it before. Technology is changing the game. AI creates an unbelievable opportunity to think differently about interoperability. We believe that we're able to put the data to work, the data that's powered incredible research with our industry partners, to now start to ask the next set of questions. So built on interoperability, link data, understanding the outcomes of patients, extending that reach into a deeper understanding of the medical care provided by the physicians in the hospital, a deeper understanding of the hospital, the nurses, the pharmacists, the medications, the outpatient care, how that all comes together. So what does that mean around modernization? What does that mean around fraud, waste, and abuse? Well, fraud, waste, and abuse are words that conjure up all sorts of emotions for
They're
folks.
sexy words, what I say.
But at the end of the day, if we're focused on providing the right care, quality care, we've got the outcomes to show for it. We can measure the value, and we're not afraid of transparency. We have an opportunity to change the entire model, change the reimbursement model, change the delivery model, do better by patients and the communities that we're all serving. So that, to me, is fundamentally what's at stake here in terms of the modernization opportunity, and we are at the table. The entire industry is at the table, and it's an opportunity for us to lean in. You know, if there's anything that keeps me up at night, it's that we're not going to move fast enough as an industry. We're not going to lean in far enough to the opportunity we have. And we've seen that before. We've had other opportunities to take advantage of a demonstration program or to try something new. And we were maybe a little slow out of the gate, a little flat-footed. Maybe there were some confounding factors, but not this time. The opportunity for us is too great. Our patients, our communities are counting on us. And quite frankly, the data is suggesting that there is so much value created by EMS that's gone unmeasured, it's gone unrecognized, it's gone unconnected. And so that's really what we're focused on. AI is a big part of that equation, how we can start to move into predictive and anticipatory models, how we can understand the populations we're serving, all sorts of opportunities to then rethink reimbursement that actually aligns with sustaining that type of care, both in urban locations as well as in rural. But it's about bringing folks closer together. It's about integrating EMS into healthcare. It's about being able to measure and quantify that so that, sure, we're going to drive down cost, we're going to drive down waste and abuse, certainly fraud, but it's greater than that. Modernization isn't just about reducing waste of all flavors. It's about improving outcomes, because that's what we all get up every day focused on. And a big piece of that is going to be how we sustain this.
So let me ask you one question. You made a statement here that said, if we're not afraid of transparency, why do you think, because this has been discussed a lot, and tell me how AI brings that in. Of course, there's a lot of conversations going on around AI right now, and we had a lot of conversations here as well. But why do you think people are afraid of transparency?
Well, transparency requires the courage to look yourself in the mirror and realize that you're not all good. You're not perfect. There's opportunities to improve. And, you know, for some organizations, ignorance has been bliss. For other organizations, it's been more of a other set of priorities have dominated the agenda. But the real challenge is to have the courage to say we're really a healthcare provider, and all healthcare providers have focused on improving their delivery model, improving their care, improving their understanding of their contribution to the ecosystem. And we're early as a profession in the broader healthcare landscape. I mentioned in our first chat that compared to physicians and nursing and pharmacy and dentistry, you know, we're really early in our journey as a healthcare provider. But that's the opportunity, is to lean into where we have an opportunity to be better and to understand that through the lenses of the rest of the healthcare ecosystem, which includes the physician, the hospital, the payer, et cetera.
You know what? I love that last statement that you made. It requires us to look in the mirror. And when you started this piece of it, and that's why leadership is really important. I'm on this Grace leadership kick because of that. And I had to do that myself. I had to look in the mirror myself and say, maybe you've got something wrong. Is there something that you should be doing different if you're frustrated with continuously talking the same points over and nobody seems to be listening? There seems to be a common denominator. And I think our industry needs to realize that. it's maybe what you just said. Look in the mirror, understand what it is, and what do we need to do to change the system, because the data is showing that we have a lot more value to give outside of just transporting patients that can really impact the system. And we need to seize the opportunity while we can. And that's why I believe doctors like you need to be leading the charge. Dr. Moy, Dr. Cozy, there's so many other doctors, I don't even start to name them. We're just whatever, getting on the piece. But I'm bought into it. Like, I'm 100% into it, and I'm going to use as much as I can with whatever reach that I have to be able to bring that to the forefront with individuals such as yourself, Dr. Beck, that's doing. So keep doing what you're doing. We appreciate it. Keep leading. You lead with you lead quietly, but you lead. And we're paying attention. We're noticing. I know I personally am. I may not like everything that you're doing, and that's okay. You're not going to like everything that I'm doing. But it's important to have the dialogues and to sit and talk. And together, our industry, I believe, can move and transform. But it is going to require looking in the mirror and making some uncomfortable change, and have the courage to do it through the process as well. So thank you for joining me on this episode of the Leadership Lab.
Thank you.